Hello everyone there. I'm Dr. Kaustubh Mahamine. I'm an interventional cardiologist. I did my UG from GMC Kolhapur and PG from the prestigious Maulana Azad Medical College, New Delhi. And then I was lucky to be trained in cardiology under some big names like Dr. Ponde, Dr. Kumar, Dr. Rajani in Hinduja Hospital. So for the last 2 years, after completing my cardiology training and working at Hinduja Hospital for another 1 year, I've been working in Nasik as a consultant cardiologist, and I have my own clinic at Canada Corner. So that is a very interesting aspect of preventive cardiology. When we see cardiology, we always wonder about 2D echo. We wonder about the angiographies, angioplasties, but a major aspect of cardiology is preventive aspect. So to keep our heart healthy, there are few points. Say suppose a person is absolutely healthy, but he is of course predisposed to heart conditions. So what he can do is work out regularly, do aerobic exercises, reduce his salt intake to normal levels, reduce his oil intake. He should not take salty and oily foods, and exercise regularly. And another aspect is he should regularly screen. If a person is above 40 years old or he has a heart history of heart disease in family, he should regularly screen for hypertension, cholesterol, and sugars. If all these things are kept in control, the chances of getting heart disease become very less. There is a definite chance for a heart attack in every individual. The way the pathophysiology of heart attack is that our arteries that supplies blood to the heart get cholesterol plaques, and these cholesterol plaques can suddenly burst and form a clot and occlude the artery completely, giving rise to a heart attack. So every individual is predisposed to heart attack given certain circumstances. But yes, not everyone will get that eventually, but certain people who have diabetes, hypertension, who have family history, or who are smokers, they are predisposed to heart attack more than the general population. Say suppose a person has predisposition for heart disease or heart attack. These people sometimes especially the elder ones, they in their bodies the heart develops blockages gradually, and when the blockages exceed a certain level, say 70% of the artery is occluded, then the person might get some sort of chest pain, some sort of shoulder pain or jaw pain, or like burning in the chest, or maybe fatigue, excessive undue fatigue or undue breathlessness while doing some exertion. Like a person who was climbing second floor easily previously suddenly finds himself breathless or excessively fatigued when he climbs the first floor. That might be an indication that he has developed heart blockages, and maybe he's predisposed to heart attack. So one should heed to those warnings. That is a very interesting question, because many patients who come to my office or any doctor's office usually do get high blood pressure. That is called as a white coat hypertension. So persons who are actually normotensive may get a elevated blood pressure in the doctor's office. So it is very important that doctor knows what are your blood pressures at home. So how can you monitor blood pressure at home? There are simple digital devices nowadays, and even FDA, the various guidelines, various societies have recommended that blood pressure should be measured with these digital devices. It is a simple cuff that is tied around your arm, and you press a button, and within a few seconds, the machine gives you a value, that is the systolic blood pressure, which is the upper blood pressure, and the diastolic blood pressure, which is the lower blood pressure. Many machines also give you the heart rate as well. So, but the only thing is these are machines. The gold standard for measuring blood pressure still remains the clinically manually measured blood pressure by a doctor. So what one needs to do is these digital machines should be calibrated by a doctor. So next time when you visit your doctor, carry your digital BP apparatus and ask the doctor to see, sir, whether this machine is working well or not. There might be an error of 2 to 3 here and there. That is acceptable. But usually these machines are accurate, and you can regularly monitor BP at home. So if somebody is hypertensive, then yes, he should monitor his BP at least once a week. Somebody who is not hypertensive but wants a regular health checkup, he can monitor his BP once a month. So forth and so on. So these machines really help. Hypertension is a disease that comes in disguise. It doesn't, the patient has no symptoms of hypertension. The patient will never land up in a doctor's office saying, doctor, I think I have hypertension, please check my BP. No, it is not possible, because it very unusual that patient may get headaches or some fatigue due to hypertension, but usually the patient doesn't have any symptoms. But in the longer term, hypertension causes heart disease. Like it can cause a heart attack, it can cause the heart muscle to weaken, causing the heart to have a lower ejection fraction and go in heart failure. Even with a normal ejection fraction, the patients with hypertension can land up in heart failure. And at a large, hypertension can cause strokes, it can cause renal failure, kidney failure. The kidneys get damaged, and almost every artery, every blood vessel that supplies blood to any organ to the body may get damaged. Even the retinal vessels the person can lose his eyesight because of retinopathy. Leg vessels can be damaged. So hypertension has a wide array of complications, and it has a very simple solution to control blood pressure. Just take your pills regularly and control blood pressure, and the chances of getting all these diseases substantially come down. COVID-19 damages heart in multiple ways. COVID-19 pneumonia can directly cause myocarditis. Like it causes the inflammation of the heart. Such patients, they go in heart failure, and their ejection fraction may get damaged. They may recover eventually, or may not even. The heart may remain damaged for a longer time. So that is one thing. It can cause directly myocarditis. But the chances of getting myocarditis or a severe form of myocarditis are very rare. Say the Chinese study showed 6% of patients did get myocarditis, but even then they will improve. But the worst part which COVID is presenting is that COVID causes the blood to clot. It causes the inflammation in the blood vessels, and it is causing the blood to clot. It can form clot anywhere. So if a clot is formed in the artery supplying to the heart, it causes heart attack. If a clot is formed in blood vessels, it causes a stroke. If the clot forms in your vessels supplying blood to the hands and legs, it can cause gangrene of the limbs. And it can also cause a clot in the lungs, which we call as pulmonary embolism, and it can be fatal. So these are the major side effects of COVID. If a person is suffering from cardiovascular disease and unfortunately he or she gets COVID, then the additional care she has to take, apart from regularly checking saturation and blood pressure and everything, he or she has to continue his or her medications regularly. And there has been a lot of debate whether to stop any particular medication or go ahead. I would say no. You continue your medications as per your doctor's advice. You continue your antiplatelets unless and until contraindicated. There might be something the doctor might tell you that please now you stop your blood thinning medications, or you stop your hypertension medication. There might be something, but that is a decision, that is a discretion of your physician. You on your part do not stop or start anything. That is one thing I would like to specially mention to all my viewers. A normal person requires at least 7 to 8 hours of sleep. And if you don't sleep healthily, it is definitely going to affect your heart. It is going to affect your body as a whole. Many patients, we ignore this disease very often. Patients are obese, and it is seen in Indian scenario a lot more than Western scenario, that patients have sleep apnea. I mean, they will sleep for 8-10 hours long, but they don't get the quality of sleep. They are snorers. And they usually get awake at night, and the daytime alertness is affected because of that. Sleep apnea affects heart in a negative way, in a way that it can cause heart blockages, it can cause heart attacks, it can cause hypertension, resistant hypertension that does not respond to medication as well. So sleep apnea is a major risk factor. So if we extrapolate this in the current scenario, even if a person does not have sleep apnea and he has a disturbed sleep, yes, it is definitely going to affect cardiac function. So staying calm and maybe meditation might help. And people who have got sleep apnea should consult that pulmonologist to get it corrected. My message to people, public at large, on this World Heart Day is: do not get afraid, do not get overwhelmed by the situation. We are all sailing in the same boat. Keep a strong heart. Do keep your regular routine of workouts and take your medications, do your screening tests regularly. Don't be afraid to go to a doctor because of the COVID-19 situation. To beat the COVID-19, you have to use only three things, and they are social distancing, mask, and hand sanitization. So if these things you are practicing, do not worry. The chances of you getting COVID are very less. Don't go near to people who are not wearing masks, and please do take care of yourself. Don't be afraid of going to the doctor when it is dire necessary. If a person is getting chest pain, if the person is getting any new symptom, do not ignore it. Do not be afraid to visit a doctor.